Very good morning to everyone. Thank you so very much for joining us this morning to start in our virtual Latinos and Alzheimer's, a very, very important topic for our Latino community. I'd like to welcome for opening remarks the Executive Director, the President of the Alzheimer's Association for Greater Maryland, Cass Noggle. Welcome.
Thank you, Veronica, and heartfelt thanks to all of you who are participating today. The mission of the Alzheimer's Association is to lead the effort to end Alzheimer's and all other dementia by accelerating global research, promoting risk reduction and early detection, and maximizing quality care and support for all affected. We deliver our mission at the community level through 78 chapters across the country, which comprise the National Alzheimer's Association. And inclusion is a critical value of our organization. It's a pillar of our strategic plan, and chapters strive for diversity and inclusion metrics, which are incorporated into our employee goals. Our Chief Diversity Officer, Ray Martinez, reports directly to our national CEO. We've asked you to join us today because we know that many families are struggling to care for loved ones with Alzheimer's and other dementias. They may not understand the disease or know about resources and services that can help them in their caregiving journey. We ask that you consider using your influence to help us reach families who could benefit from our services. I'd like to thank Veronica Cool of Cool & Associates, with whom we've worked for several years to help position our organization to better serve the community, and also our esteemed panel of presenters who are all champions for this cause. The Honorable Joseline Peña-Melnyk, Dr. Andres Salazar, Marie Lopez, and Veronica Cool. And now I'm pleased to introduce Michael Ruiz, who is a board member of the Alzheimer's Association. Thank you.
Good morning, everyone. Thank you for being here today. I have the pleasure of introducing Delegate Joseline Peña-Melnyk as one of our honored panelists. As a Dominican American and representative of the Prince George's and Anne Arundel counties since 2007, Delegate Pena is a longtime advocate of the Latino community, particularly of the Alzheimer's Association. Delegate Pena is a tireless advocate for finding the cure for Alzheimer's disease. She received her law degree from the University of Buffalo Law School and has been a member since from 2013 to 2016 of the Virginia I. Jones Alzheimer's Disease and Related Disorders Council. Among her many notable accomplishments, Delegate Pena was recognized as one of Maryland's top 100 women in 2015 by the Daily Record, and was later recognized as an outstanding legislator of the year in 2017 by the Maryland Hispanic Chamber of Commerce. She currently serves on the House Health and Government Operations Committee, as well as the subcommittee member on both the government operations and public health and long-term subcommittees. Thank you so much for being here today and talking to us about your advocacy for Alzheimer's.
Thank you.
Veronica, I'll turn it over to you. Oops,
Great. Joseline, you go ahead.
Thank you, and good morning. And Veronica, thank you so much, for your work, and all of you, Cass. We've known each other for many, many years. So this is a really important issue for our community, because I feel that there's definitely a need for information and education in our community, and to know where the resources are. I know that I get the calls in my office all the time, and we try to make those connections. So by the year 2030, Latinos and African American will make up nearly 40% of the 8.4 million people that are living with Alzheimer's. So I want to give you a picture. By 2030, the number of Latinos aged 65 and older will have grown by 224%. The number of African American by 114%, and the white community 65%. So what does that mean? That we're going to be a big number, our community, Latino community, of people that have this disease. As we know, we don't have a cure for it. But because we don't have a cure, that doesn't mean that there's some, treatments or therapy, and that our community can get involved. We also, as Latinos, not just regarding Alzheimer's, suffer from not being included in a lot of these studies, and which is really important because the #1 risk factor for getting Alzheimer's is advanced age. And as I said, we're going to have a lot of older Latinos in our community. And I think that there's a lot of education when it comes to making healthcare decisions in our community, guardianship, advanced planning, access to care, patient abuse. I mean, there's so much that our community needs. It is thirsty for information. A lot of times we're taken for granted. And that is a problem because we are also suffering from this disease. We need to increase public awareness. We need to teach our community about early detection and diagnosis. We need to educate our healthcare providers, and we need to get more healthcare providers to speak the language, that know the culture. That is so important that we do that. And when we look at the workforce and we build on a dementia capacity workforce, we need to also attract people that look like us, because you have to be careful and be very mindful of who the messenger is. And I am someone that cares deeply about this issue. As you know, I put in the bill for the Virginia Jones Council, and I've been very supportive in the committee of this cause because it's very dear to me, and I thank you for the work, and you can consider me a partner and a friend.
Joseline, a million and heartfelt thanks, seriously. The reason we are hosting this event in a virtual fashion is obviously because of the coronavirus pandemic. We want you to know that this was scheduled to be in person. This was truly meant to be a celebration of the partners that have made the organization successful in supporting Latinos. This is not an easy topic to address, to fix, to move and forward. So we intended to honor Joseline because as humble as Joseline is, she's often behind the scenes pushing forth legislation that makes this progress a reality. So, we're settling right now for some virtual hugs and high fives. But of course, but our intention is to gather all of us as a community once again when the time is appropriate. Health is important and we value that, but that doesn't mean that we need to be disconnected. So we've asked these fantastic panelists, Sarah, if you can go back one slide, to join us to share their stories. I mean, the title of this event is A Moment to Share, because we have come from different places and it's not always the same. If I read an article, I see something in the paper, it may not apply to me. So the reason we gathered these awesome people is to share their story, to share their resources, and how Alzheimer's Association is interwoven into all of that for us as a community. And you all may know that my father passed away 2 years ago from Alzheimer's and dementia. And my papi was an unbelievable man that lived to be 92. He was a fire chief in Dominican Republic. And when we went to deliver his remains, he had left about 50 years ago. Obviously, he had visited back and forth, but he had made a new life in the United States. And even when we went back 50 years later, people stopped me on the streets to tell me what my father had done and the legacy and the mark he had left in this world. And he didn't remember any of that. He had no idea that he had done that. So the reason I'm involved, the reason I'm so privileged to work with Alzheimer's is because I don't want our history erased. I don't want our children to grow not knowing that we have heroes. I don't want them to forget what it's like to journey to a country and create something out of nothing. And we have a lot of our community fighting and struggling. So it's very, very important that they know we have these resources. And having Dr. Salazar, Maria Lopez, and Joseline on, it is how we change that narrative, how we tell stories, how they connect us to our community. This is no longer an abstract subject. This is hitting home. So I like to take this time to just kind of go through our panel, have them introduce themselves, and give us a little bit of background on how they became involved with Alzheimer's, and to just give us a little bit of love. So, Dr. Salazar, bienvenidos. Muchas gracias por estar aquí con nosotros. Can you tell us a little bit about your background and your practice, and a little bit about how you became involved with Alzheimer's?
Hey, good morning. I just, first of all, I want to thank Veronica and the Alzheimer Association for making this event possible. Thank to our colleagues that continue to work hard to improve the lives of residents of patients with Alzheimer's disease, as well as their caregivers for their, magnificent work that they do on a daily living and the sacrifices that they go through every day to take care of patients with Alzheimer's disease. As everybody knows, taking care of a patient with Alzheimer's disease is a 36-hour-a-day job, and this job is never paid. And though there is support from the government, the support is not enough for the amount of hours that caregivers of patients with Alzheimer's disease and related disorders have to go through every single day. I think I started taking care of residents of people with dementia since 1994, when I started my fellowship in geriatric medicine in New York City at the New York University Medical School. After I finished, I came to Maryland to work with Johns Hopkins from 1996 to 2002. And basically, I had been working basically in long-term, continued care retirement communities, assisted living, nursing homes, post-acute care, adult daycare centers, outpatient medicine, and geriatric medicine in the hospital setting. After I left Hopkins in 2002, I became an independent consultant for all these facilities. And in 2012, I received a phone call from the governor's office to ask me if I wanted to join the commission, the Virginia Jones Commission on Alzheimer's disease and related disorders. And I was kind of surprised. The first question that I asked them was, hey, who gave my name? Because I'm a person who have a low profile. I'm not a famous person. I'm very committed and I'm very passionate about geriatric medicine, but I never expected that the governor's office was going to call me to join the commission. And I think basically they told me that they called the health department for candidates and they say, hey, call Salazar. He will help you. And that's the way I was basically started officially with the commission. 2012, I think the main job of the commission was to create a plan of Alzheimer's disease and related disorders for the state of Maryland. President Obama had mandated that every state needed to come up with a plan to address the growing crisis of dementia in the United States. Then basically, 2012, we started the commission, and I think early 2013, we provided the report to the president. It was at this time, 2012, when I started working with the Alzheimer Association, and I had the honor and the privilege to work with several members of the Alzheimer Association, a few scientists from Hopkins, people from all walks of life, including patients affected with Alzheimer's disease who were in the commission. And basically, after we finished the report and we elected, I'm sorry, I was going to forget something that is really important that has helped us a lot with the elected officials. That was very important.
Okay.
And
Thank you.
We provided the report in 2013, and later I transitioned into the council, the Virginia Jones Council for Alzheimer's disease and related disorders. And up to the present, I'm one of the active members of the council. And as I said before, I'm very passionate about geriatric medicine. I would say that 70% of my practice is basically geriatric medicine, and not only geriatric medicine, patients with Alzheimer, dementia, and related disorders. Unfortunately, most residents in nursing homes, I would say at least 70% of patients or residents living in nursing homes, they have some degree of cognitive impairment and or dementia. And thank you for having me. And
thank you, Dr. Salazar. We appreciate it. We are going to go into, in particular, exactly what those symptoms are to educate our community. But before we go there, I'd like to welcome Maria Lopez. Maria has a very, very interesting role with Alzheimer's. So I'd like for Maria to introduce herself. Maria, can you share a little bit about your background and what has motivated you to become involved and to be part today? Bienvenida.
Of course. Gracias. Hello, everybody. Well, my name is Maria Guadalupe Lopez. I was a teacher for 18 years. And in 2014, I need to bring my dad over to live with us because he started showing signs of dementia. Unfortunately, yes, he had Alzheimer's, and I had to be his caregiver for 4 years until he passed. On 2015, I had to quit my job because I needed to take care of him the whole time. But it was very hard, so I started looking for help. And that help was for me to find the Alzheimer's Association. I was able to find that they have support groups which were able to keep my sanity because I was dealing with something I didn't understand and I didn't know anything about it. But through the support group, I got all the information I needed, and the experience from my friends in the groups that I met, they were able to teach me how to deal with these situations I was dealing with. It was very important for me to be able to have people who would totally understand what I was going through, because it doesn't matter what you tell people, nobody understands until you go through that path, what you're going through. And thanks to the association, I was able to get education, knowledge, some resources, but most importantly, I got a family of friends that helped me through those difficult times.
Maria, thank you for sharing that. I will share a statistic that the most prevalent caregiver, especially in the Latino community, tends to be the oldest female sibling, and the burden falls on that individual. So not only do we have the sandwich generation, right? The one in the middle that's caring for the elderly and the youngsters, it tends to be the female. So there's some additional burdens that are important to just be aware of as we're talking about Alzheimer's. But I want to go back to Dr. Salazar to just talk about the basics, because culturally speaking, I'll be blunt, we think that our little viejitos are just getting old. Ah, no, el viejito está viejito, he's just old. It's more than that. Salazar, Dr. Salazar, can you give us a little bit of a difference between normal aging and potential symptoms for Alzheimer's?
yeah, that's correct. I think one of the early symptoms of dementia is memory problems. Of course, we have several cognitive domains, including memory, including speech, language, executive function, but a cognitive domain that is frequently, sometimes the most frequent domain affected in patients with Alzheimer's disease is memory. People start having problems with recent events. They might misplace their keys or valuable objects, and even worse, they can't retrace the steps. When they try to remember when they left their keys, they can't remember. I think the difference between normal aging and Alzheimer's disease is that in normal people, sometimes we forget things, but we're able to retrace, and those things don't become pervasive in our lives. Patients with Alzheimer's disease, that becomes frequently, and that start affecting the activities of daily living of the patient, the functional status of the patient, and it start affecting their lives at the psychological and social level. Then when memory becomes a problem and affects function, is not a normal aging process. As I said before, we all have difficulties with memories. Sometimes we might forget the name of a friend, and that's okay as we grow older. But when that becomes pervasive and families and friends start noting that it's not normal, is when families and caregivers need to ask for help.
So when we go to the next slide, these are some of the common effects and characteristics of Alzheimer's. Dr. Salazar, what would you say is the most important thing for families to understand about a loved one when they're diagnosed?
Okay, one of the things is that, and this is what I see in Latino communities and in Caucasian communities, in every community, is that there is a misunderstanding of the patient affected with Alzheimer's disease and related disorders. They think that everything they do is purposefully. Oh, wow, he's acting this way because he's manipulating. Oh, wow, he's acting this way because he just wants to control. And we need to be kind and understanding that it's not the patient's fault. They have a condition, they have a disease, and we need to be kind and compassionate. And you should basically detach from the person and see the patient from your perspective, from your caring perspective, from a loving perspective, from an understanding perspective. This is not a patient that is acting this way because they just want to, they have a secondary gain. No, these patients, they're sick, they have a condition. It could be Alzheimer's disease, it could be vascular dementia, it could be other type of dementia that is affecting their cognition and their function. Something that our communities need to understand is that Alzheimer's disease and dementias in general, they're not only affect the intellectual part, the cognitive part of the individual, they affect personality, they affect function, and they basically cause severe consequences in these patients, including dementia. Sometimes some of these patients may exhibit angry behavior and aggressive behavior because they themselves feel frustrated because of the condition. Then Alzheimer's disease is a disease that affects the entire human being, not only cognitive, but also social, physically, and functionally. Then I would say we need more compassion, we need more love, we need more understanding of these patients.
And an additional point is the stigma. As a culture, we don't like to air our dirty laundry. And we're not going to say, papi tiene, you know, my dad, my mom has it. We tend to keep that under wraps. And we don't know how to use outside resources. We feel, and this is Veronica speaking personally, that we're throwing away our viejitos. We're not going to put them in a nursing home. We're not going to put them there without understanding that there are resources available for us, that they're better equipped to handle us. My mother invested about 7 years of her life caring for my father. And of course, it was the most loving and compassionate care that this man could have ever received, but it came at a high price. It came at the price of my mother working 24/7. And it took a lot. It took a lot out of my mom. And you know, how many people are going through that while working full-time, while caring for children? So I think our resources are there, but we're not sharing them. So this is one of the reasons, Delegate Joseline, it is so important to our community, because as a legislator, you have aided us in funding to provide the resources like the 24-hour hotline with Spanish-speaking reps, any other language too, not just Spanish. But you know, you shared in your introduction some of your work. But I want you to be even more direct about what can be done to ensure that more resources are allocated for our community, number one, and what, especially for funding around medical testing and medical research so that we can find the cure. Right now, Latinos are culturally hesitant to participate in medical studies. They don't know that it's legit. We don't know how to do market research. So having Joseline in a position of, there's only 4 Latino legislators, by the way, in the state of Maryland. So having Joseline with a seat at the table, it's huge for us. But give us a little direction, Joseline. What can we do? What more should be done so that we can get the word out?
I think that what we need to do is, again, inform the community, educate the community that this is an issue, looking at the numbers, right? And how this community is growing. I think on our committee, we have hearings, and oftentimes you come, Cass knows this, you guys come and you give testimony. You also have the Speaker Pro Tem, Cherie Sample Hughes, who is actually a member of the Virginia I. Jones Alzheimer's Disease and Related Disorder Council as well. So that helps. And frankly, in a very humble way, as a legislator, myself being able to talk to my colleagues that are in key positions like Maggie McIntosh on appropriation, right? Who is actually the chair of the Appropriations Committee. Talking with the Speaker of the House and the President of the Senate as we make these policy decisions and we decide in the budget, which is so important. I think that as we move forward, especially with what's happening with COVID, right? That there are a lot of stresses on the healthcare system, and this is definitely an issue. Alzheimer's should be part of that discussion as we look at budgeting and what priorities we're going to be setting forward and requiring in January. So you need to have advocacy. You need to make sure that we have 141 delegates. You have 47 senators, 188 of us. You need to make sure that each and every one of them, and I know you do this often, gets a little handout, 1 page, okay? 1 page about the organization, 1 page with the key statistics and number, and make sure that they have it. You need to have people from their district to write to them, because we as legislators, we pay attention. I pay attention to everyone, right? But you definitely pay attention to those that live in your district, that are voters, to make sure that they share their experiences and that they write to us and say, you need to make this a priority. So it's at the very grassroots level, doing the advocacy and the education so that you can have more friends that are in the room, okay? More friends that will carry your water and will open their mouth and say, but wait a second, did you think about the Alzheimer's Association? Did you, think about how Latinos and Blacks, are affected? Did you think about there is an opening on this board, finding someone from the Alzheimer's Association to be part of it so they can bring, their view to the table? So that is how you do it. All those layers at the very grassroots, that is how you make, and you're impactful, frankly.
Well, it's about removing those barriers that we have. I mean, in being at the table and providing the funding, number one, is huge, but having our community kind of raise their hand and say, oye, I don't have insurance. I don't know what the special enrollment from the Maryland Health Exchange is to cover my family. They don't know that you can go to the state and get coverage. They don't know that the 24-hour hotline exists. The providers, it's not often that we have a Dr. Salazar or Dr. Alicia that understands the cultural difference, that they know that our community, like for my father, when he was later on in his hospital state, didn't like to be touched by females that weren't his wife. He didn't know what they were doing. So, having a provider that understands the excessive respect that must be displayed, especially to older males, is huge. And I think someone like Maria, who got involved because of her father, I think, I love to hear from you, Maria, a little bit about your journey as to what Alzheimer's Association helped you do, what resources were there, how can a regular everyday Latino like you, like me, access these resources? What are there? I mean, we have a question from the chat. It says, I'm in the Eastern Shore. What can be done to help our communities? If you can help us with that, Maria, would be great.
Yes, well, two different things. First of all, I think I accessed the Alzheimer's Association through the web page, and I tried to find more information about it. I realized the website is in Spanish and in English, which is really good. And then I learned about the conferences that they were having every year. So I started going to them and learning about the disease and how I could help my father better. That was very important to get the education that you need. They have a lot of pamphlets done in a lot of different topics. They are really, really good. Maybe we should be able to have them in different places for people to access them and not to have them hiding in a place where they don't have a place to be shared. We need to pass the word. And I think as a community, we should think this very truly. Sometimes we tend to joke about Alzheimer's, but I can tell you it's not a joke, not when it hits your family. So if we all have a voice, we can do something about the community. We have to share the information. We need to make sure that people know about the help that is available. We need to be volunteers. It is not always easy to access the Hispanic people because there are not so many volunteers. We can all volunteer. When you are having a very desperate situation, all you need is somebody to hear you. So maybe you can volunteer to do that. Also, we need to volunteer to have support groups. They are so important. They are so needed. And yes, it is important that people go through that and understand you, but maybe if you haven't been there, you can be an organizer or you can be the person who passes the voice about the support groups. I think we can all do something to help the people who are going through this situation.
And as Maria was sharing that, we were flashing on the screen various resources that exist. I mean, to be really, really blunt, Alzheimer's Association is one of the best kept secrets that the Latino community has. Everything exists in Spanish, everything. The entire website is in culturally appropriate translated Spanish, really engaging. I like to invite Cass and Eileen to chime in with me here so that you get a sense for just how much is available to you as Sarah scrolls through the various screenshots of the resources. For instance, there's self-paced training courses. So if you wish to become a trained volunteer, an ambassador to the community, thank you, Sarah. It's online. Additionally, the support groups that Maria mentioned exist today. So I want to take a little step back. This is in English. I've had a couple of folks go, oh, eso va a ser en español. Will this be in Spanish? It's for Latinos, right? So all of it is available in Spanish. We opted to have this in English because most of our providers, all of our providers speak English. And we're trying to reach those that serve Hispanics. So the middleman, the Dr. Salazars of the world, the Maria Lopez's of the world, the middleman. Because right now, our community tends to operate with the mentality of Band-Aids. We personally solve the problem for the person asking for the help versus empowering them, versus teaching them to fish. We give them the fish. So the goal with this conversation, it's a FYI, you have this literature, you have this support group, you have this tool in English, but all the tools are available in Spanish, with the biggest objective being that now you have this in your artillery, in your toolbox. So when you get a request in the Eastern Shore, when you get a request in Dundalk, you can say, sí, tenemos eso. I don't want you guys walking away going, gosh, now I have more information and I'm drowning with problems. We're resources, we're a tool here. So Eileen and Cass, if you can jump in, either one, of course, and give us a little bit that I may not have covered in terms of the available resources that you're seeing as really effective and impactful for the community.
So I'll go ahead. The one thing I want everybody to leave here today knowing is our 800 number, the helpline, 800-272-3900 is available 24 hours a day, and we have live dementia experts, including bilingual experts who can be reached 24 hours a day. And it can be a simple question like, do you have a list of adult daycare facilities? Or it can be more complex like, I don't understand what this behavior means. I'm getting really frustrated with dad. Can you help me? Or just lists of resources or tips for caregivers. We also are planning to have a Spanish language support group. So we know there is a need out there, and Maria has agreed to facilitate that support group. So we look forward to doing that in the future. Cass, did you want to add anything?
In addition to the services that you see on the screen, we also offer care consultations, and this helps families who are very overwhelmed to establish a plan going forward for the care of their loved one and connecting them to whatever resources they may be eligible for. And all of these services are free.
And I wanted you to clarify, Cass, because I'm hearing things like support groups, training, Spanish servicing, care consultation, and I'm thinking, oh my gosh, how much is that going to cost me? How much is that going to cost me? So thank you for saying that these services are included. This is free. This is a resource, again, in Spanish for our community. So thank you, Cass. We're going to wrap up the panel. I'm going to ask our panelists some closing questions, and then we're going to be teeing it up to listen to you guys. So start thinking through your questions and having them either on the chat. It'll be easier than trying to voice them. So think through, and you are more than welcome to write your question in Spanish, and we'll translate it as it's read. Dr. Salazar, talk to us, in closing. We know that the Latino community has been raised to not really ask for help. What can we do to help? You in your practice, you're seeing this every day. Is there something we can do as a community to lift the veil and make sure that it's understood that it's okay to ask for help, and these top 2 or 3 symptoms or behaviors should be watched for and go take action? What can you close out with to give us some direction?
No, thank you. I think we need to start with education. Education. Information, telling our communities what Alzheimer's disease is, the symptoms of the condition, what to do about it, and what are the resources that they have at hand and the resources that should be used right away. Well, there are many ways that I would say for us to get into the Latino communities. One thing is through our churches. I think it's very important through our churches to educate our Latino community that, many of our immigrants, they usually go to church at least once a week. Then we should use our churches. We should use our primary care doctors who speak Spanish to disseminate the information. We should have this type of virtual meetings, I would say more frequently. This should be not like once a year, at least once a month. We should have a virtual meeting with our Latino communities and disseminate that the information that this is there and they could be, part of this virtual meeting. But I would say everything boils down to education.
Okay.
Disseminating education and making people aware that the resources are there. Because unfortunately, on television these days, most of the time, what the media wants to show is negative events. Everything basically on television is negative. There is nothing uplifting or something educational. Then basically,
And no, you're absolutely right, Dr. Salazar. And that's one of the reasons I think the support groups are so needed. So it's a positive outlet to process this. So Maria, I'd like you to share your support group request and let people know how important that is and what they can do to get involved through a support group, por favor.
Okay. Tell me the question again. I didn't understand your question.
Sure. The importance of having a support group and the fact that it was really helpful to you. How can people get involved and how they can leverage a support group?
Okay. First of all, there are so many different support groups around the area. We are many Latinos that speak English as well. So you don't have to wait for a Spanish speaking group to join one. There are so many different ones. You can just go to the page of the Alzheimer's Association in Maryland and find different groups that might be close to you. What it did for me was it educated me, as I was saying, but gave me the support. I was totally blank. I didn't know anything about Alzheimer's. I didn't know how to handle it. I didn't know why my father was not my father anymore and how it was changing. I didn't know how to vent. And it gave me the opportunity to have people to understand me. I think having the support group once a month was totally my sanity. I wasn't able to explain to anybody what I was going through, but to the people in that community.
That was your outlet.
It was totally the help I needed. I was in situations that I needed to call the hotline, and they were there for me. It is very difficult to do it by yourself, but you don't have to.
Very, very, very important to hear that we don't have to do this by ourselves. Thank you, Maria. Delegate Joseline, in your fight, in your advocacy in legislation, give us some closing thoughts on how we can support your efforts to ensure that funding is continuing to come for the resources that we need, especially language, especially, support groups and funding Alzheimer's Association so that our community continues to have all these wonderful, wonderful resources. What do you need from us?
I need you to stay present in Annapolis. Make sure that, as we start a new year in January, where we have session January to April, that you have a presence like you always do. But before that, use this time, this period, to communicate with the legislators. Make sure that you send them that one-pager. It's a constant reminder, with the facts and the needs and the issues. And also make sure that the, members will contact, the voters contact their representatives and talk about Alzheimer's and share some personal experiences with the members, because it's different when you just read about it than when someone shares some personal experiences where you can build a connection. It's sort of human nature. And then also make sure that, and I know you do, but stay involved and advocate at the federal level as well, because it's very important with the Maryland delegation, where we have 2 senators, right? We have a 10-member delegation in Maryland, 8 representatives and 2 senators, so that they're also, are involved and are informed. And I agree with Dr. Salazar. What's needed is a lot of education in our community, not just education for the caregivers, for the providers, but for the policymakers to understand the impact and how many people are affected in Maryland, which right now it's almost 100,000 people, and how that number is going to grow. And at the end, I feel like you either pay now or you pay later. So you might as well do the investment now.
Very, very powerful. Thank you. Thank you. I like to open it up to the audience, the folks watching. What questions do you have? So think about that for a second. But I know that we have Councilman Gabe Albornoz from Montgomery County, who chairs the health committee there on. We would like to have you join and give us a little update on what's happening in your world, and let us know if you have any questions. Welcome, Gabe.
Thank you, Veronica. So I saw the flyer for this panel and I thought I have to participate in this because, first of all, Joseline is a sister, and we've worked together on so many different issues, and congratulations on the recognition. I want to follow up with you after this panel because I'd like to work with you collaboratively on a state and local partnership. This issue is very personal for me. In the summer of 1992, I grew up in a multi-generational house. My abuelitos live with us, and we noticed that something was going on with my grandmother. She was the smartest, most caring, most loving person I'd ever met in my entire life. To this day, she still is. And there was a turn. She started to get very anxious, angry, aggressive. And that summer, I actually got my driver's license. And my mom and dad were at work, and I was at home. And she wanted me to drive her to Santiago, Chile, to the house that she grew up in. And we went back and forth, and I tried explaining. I brought out maps, and it was just devastating to me how upset and hurt she was that I wasn't willing to just simply drive her to Santiago, Chile. And she actually left the house. She started walking on her own. I called my mom. She came home from work. It was a tragic and horrible situation. And I know the pain and anguish that my mom went through throughout that entire period, and my grandfather as well. And so this issue is so critically important because I don't know a single person who doesn't have somebody in their immediate circle that isn't impacted by dementia or Alzheimer's. Not a single person. And the fastest growing demographic in Montgomery County and in our nation is our aging population. 9% of the population in Montgomery County today is over the age of 65. That will be 17% in the next 9 years. And so it's critically important that we do everything possible to invest in organizations like the Alzheimer's Association, organizations that are equipped to provide life-saving and important information for both addressing the needs of the patients, but also the loved ones who are caring for them and helping them with respite care and helping them to process all of this very difficult time in their life. And my question is to kick off the question component of this panel, and I do very much want to get more involved in this issue. I'm in the 7th month of my 2nd year on the county council, but as chair of the Health and Human Services Committee, this is an issue I want to elevate more here in Montgomery County, and so I will be following up with you guys after this. But my question is, what can we do from a preventative standpoint to address Alzheimer's? You know, we know about puzzles, we know about crosswords. What are some preventive measures as we start to see signs that people can take that are free and that are accessible, but that can help delay the onset of this terrible disease?
Thank you. Dr. Salazar, could you let us know that?
Yeah, absolutely. Yeah, basically, we already know that the risk factors for Alzheimer's disease and related dementias are the same risk factors that for cardiovascular and cerebrovascular disease. Then if we address the cardiac risk factors, we'll be addressing dementia. And the cardiovascular risk factors are basically aging. As we grow older, the risk of dementia increases. For that risk factors, we can't do anything else. And for the genetics, we cannot do anything else. But for diabetes, that causes metabolic syndrome, for hypertension, for cholesterol, for diet, for exercise, for smoking, for sedentary lives, we may address all those risk factors. And by addressing those risk factors, most likely we're preventing both cardiovascular disease and Alzheimer's disease. Then we need to educate our Latino community that doing prevention for the heart will do prevention for the brain. Then we need to teach our Latino communities to exercise, to eat properly, to go to their doctors on a regular basis to have their cholesterol check, their blood pressure check, their weight check, because obesity is another risk factors for cardiac disease. And I would say diabetes is one of the most important ones. Diabetes have a lot of negative effects, not only physically, but cognitive, because that we develop something called the metabolic syndrome with high insulin levels. And we have seen that the metabolic syndrome causes increased blood pressure, increased cholesterol, and increase inflammation. And that damages the brain cell, damages the brain.
So, and it sounds like we just don't have enough information as to how all this works, especially for Latinos. Obviously, being healthier, eating, exercising, sleeping, managing your stress levels, all those things matter. But I'd like to ask Dr. Alicia, if you can get yourself off mute, you can briefly tell us about your study, because I think this will feed into what Dr. Salazar just mentioned.
Thank you all. Thank you so much, Veronica. Mucho gusto, everybody. I'm Alicia Arbaje. I'm a geriatrician and clinical researcher at Johns Hopkins. Dr. Salazar, I just missed your tenure at Hopkins. I joined in 2003. I'm so sorry I never met you in person, but I'm glad to meet you now. I feel like there's a lot of kindred spirits here on this call, and I'm so excited to be here. I'm Dominican. I grew up in rural Kansas. I know, we got a lot of Dominicans on this call, more than I've met in the last few months. So I grew up in Kansas with my grandmother, who I probably did not have dementia, I think, at the time, but had a lot of chronic illness and was in and out of hospitals in rural America without speaking the language. And that's what prompted me to become a geriatrician. And I practice in the hospital setting primarily with adults and general geriatrics at Johns Hopkins Bayview Medical Center. I have been doing research for the last 16 years on older adults' experiences at home when they come home from the hospital. I go to people's homes and explore their experiences and how we can make them better. And my goal is to improve the health system to be more welcoming to Latinos, to be more welcoming to older adults, to help develop trust between our patient population and our healthcare providers. And our study is to bring a voice to older Latinos with dementia or their caregivers to first understand what are their needs when they come home from the hospital, if they interface with the hospital system, how can we do a better job, and what are the ways that we can provide more culturally proficient care. And so I'm recruiting now for anyone. It's a remote study. We don't go to their homes. They don't have to come anywhere. You know, with the pandemic, we're trying to be really safe in that regard. We want to interview want to interview caregivers of Latinos who have dementia, or the person themselves if they're able to participate, and just ask them to keep track of their, what's going on in their life for us in a diary for a couple of weeks, so we can understand the ins and outs of what it's really like. And then use that information to engage people in a second part of our study to help design some interventions to help. So if you all know of people I could connect with, or if a place where I could speak more about this, I'd put my contact information in the chat. I'd be very delighted to help. And the whole point is to bring dignity to the care that we provide to older people and their families with dementia. So happy to be a resource, and very excited to get to meet such an esteemed panel. Thank you for this opportunity. Gracias.
Thank you, Dr. Alicia. That is fantastic. We'll share that information, and this is exactly what this is about. I'm going to ask Mike Ruiz to jump on with me once again, because we want to close with some requests. This isn't just about a one-way street of us dumping things on you. It's also about getting your input and your feedback. So Mike, can you join me? And you're a board member, you're a Latino on the Alzheimer's board. What can people do to get more involved, Mike?
Well, thank you for the opportunity. What an incredible panel. I've really learned a lot from listening to everyone, and I'm incredibly motivated by the passion of our civil servants who are connected to this. This is a topic that's near and dear to my heart. Both my grandmother and my mother. My grandmother died of Alzheimer's, suffered of Alzheimer's for almost a decade, and my mother was early diagnosed and is currently living in a nursing home. I think that for me, for our family, it was very difficult to make the decision to place my grandmother in a nursing home first. But it became a necessity when she started falling and having issues that we were no longer able to adequately control inside our family. So organizations like the Alzheimer's Association helped us to be able to make the right decision in order to be able to support her in her time of need, and we've been able to do the same for my mother, and really get awareness on medication. So visit, call our 800 number, get help in Spanish or in English, visit our website, get involved in volunteer opportunities, support us in the walk that we do every year as those become available after this COVID. This is a difficult time in our nation's history. We have a lot going on, but these folks are still suffering from their disease, and they need that help irrespective of what's going on around us. Don't be afraid to seek help, even in this time of COVID. Our healthcare institutions are doing an amazing job of being able to provide the kinds of services that are needed in a safe and appropriate manner. So please reach out, call, visit the website. The website's available both in both Spanish and in English. So if you rather consume the resources that way, but ask for help. It made all the difference for our family. It'll make all the difference for your family.
Thank you, Mike. Really appreciate that. So if we can go to the next slide to wrap up, I'm going to ask you guys to please stay in touch. We have all the platforms under the sun. We provide content in Spanish. There's just a lot of support, like everyone has mentioned. So if you're not already on the distribution list for Alzheimer's, please join. Please follow us on social media. If you have the bandwidth to be a volunteer, let us know. If you have the interest to join a support group, facilitate a support group, let us know. If you want to get on the board and advocate policy change and support the organization, let us know. And just know this is just the beginning. We will have an event in person when the time is right, and we'll continue to get connected. I mean, just from a 1-hour discussion, we've made various connections, and we've opened up the chains of communication. So this is for you as a community. We thank you. I want to thank Sarah on my team for making this super, super smooth. I want to thank the Alzheimer's Association. I admire and commend you for knowing how important our community is and taking action. Not very many organizations value us that way. So the fact that for multiple years you've reached out to us asking what can we do and ensuring the resources are on hand is commendable. And from my family's behalf, I thank you. The panel, Dr. Salazar, Maria Lopez, Delegate Joseline, Mike Ruiz, you're doing this for love. You guys aren't getting compensated, and we know time is precious. So thank you for giving us the time, the energy, the compassion to empower and educate our communities. So Cass, I'll turn it back to you to close it out, and just know that we are super, super grateful to have you all with us. Cass?
Well, I would just echo everything Veronica said. These are such uncommon times, and there are so many important issues that require your time and attention, and we are so grateful that you took the time to join us this morning. Again, as Veronica said, this is just the beginning of the conversation. We have many ways to involve anyone who wants to get involved. We have a very active public policy program at the state level. We have an annual advocacy day. At the federal level, we have quadrupled research funding for Alzheimer's disease from $440 million in 2011 to $2.8 billion today. We have teams of advocates who are assigned to every single member of Congress in the country. There are so many ways we could use your help and your expertise. Also, the second largest impediment to research is not having people to participate. And when we ever find that cure for Alzheimer's disease, that effective treatment, we want to make sure that it's effective for all people. And we need all people of color to participate in our research efforts. We have a program called Trial Match that you can go online, or we can give you a number, and you can set up a profile and receive information on research that would affect you. And again, many thanks for your participation.
Muchísimas gracias. Everybody have a fantastic day. Please stay safe. Please keep in touch and be compassionate, like Dr. Salazar just said.
Take
Muchas
care.
gracias. Gracias.
Thank you.
Thanks for your work.
Thank you.
Bye.
Gracias a ustedes.
Thank you.
Gracias.